Hi, Chris Westfall here. I've got a lot of updates for you about what's happening in the world of Medicare. There's an IBM retiree suing IBM because they're forcing him into a Medicare Advantage plan. And we've got some news on the other organizations that have been doing a very similar thing. We also have a new report from the hospitals saying what's going on with Medicare Advantage, something you probably need to know if you're on one. Then we've got the marketing limits that CMS is going to propose. Well, they've already proposed it, going to implement maybe in 2025, and some really bad agent reaction. And you'll see some news stories about that. But first, I want you to hear the message from an insurance commissioner. This just came out this week. This is from the great state of Mississippi, where I've been licensed since 2009. And he's very concerned about what he sees going on. You know, the Department of Insurance in the state has very limited powers when it comes to Medicare Advantage, but one of the things that they do is they try to advocate for seniors or for anyone who is using insurance. That's one of their roles. And well, I just want you to hear in his own words what he's having to put up with and what his warning is for the people of Mississippi.
Happening right now, and that means you may be possibly open to changing your plan. Joining us now on the 4 o'clock show from the capital city is Insurance Commissioner Mike Chaney. Commissioner, I understand the Insurance Department has received some complaints from insured patients, if you will. What have been kind of the nature of some of those complaints?
Most of the complaints that we receive concern people being switched from regular Medicare Part B, D, or F to Medicare Advantage plans, which a lot of companies are pushing because there's more money for them in it than it is for the patient. And the complaints are that the doctors are not in the network. The doctor they've been seeing for 20 years suddenly taken out, that they're not approved to go to the hospital to have needed surgery. I had one this morning from a major media company that said, call the commissioner, he can help you, where the company just decided they didn't want her to have surgery at her age on the shoulder. So the complaints we have are about switching from regular Medicare and not telling the consumer what's going on.
You know, Medicare is a federal program, obviously, and you're the state insurance commissioner. But so you regulate to a certain degree. Tell us a little bit about that, the kind of supplemental coverage.
So Medicare is administered by the federal government. As commissioner, we have very little authority to regulate the companies. I've taken a different route from most commissioners. A couple of us have decided that we can tell the companies if they don't act right, we'll pull their license to do business in the state. And that tends to get their attention, and they start acting a little better. But the biggest problem is we just don't have authority to regulate the Medicare Advantage plans. And we've got a little more regulation authority than we had last year. But if you got a question or you have a concern about Medicare, call the Department of Insurance or call your local agent that sold you the policy. And by the way, they can't make a cold call on you. They got to be licensed by the state so we can rein them in if there's a problem. And they can't make unsolicited calls. Be very careful about changing over to a Medicare Advantage plan. Once you get on an Advantage plan, if you try to go back to a regular Medicare plan and you're sick or you really need help, they can rate you. In other words, your rates will double, sometimes triple, based upon your health condition. That's something you can't do in regular insurance, and you can't do it on regular Medicare. So be very careful if you buy an Advantage plan.
Well, that's all great advice there, Commissioner. You say you can't regulate, but they are licensed in the state.
Right now, we have somewhere a little north of 100. So there are a lot of people in the market. 90% of them are very straight, but you've got a few people that promise you things they can't deliver. And especially if you're on life-saving drugs, be very careful. Be certain that your drugs are covered, and ask the question, will they be covered for a year? If they say they will be, get it in writing so that you're certain that your drugs will be paid for and they won't take them off the list 2 months after you buy a program.
Okay, Commissioner Mike Chaney, it's always good to see.
Here's my insurance license in the state of Mississippi. As you can see, it was issued in 2009. Been there for a few minutes. We've got a lot of great clients in the great state of the Mississippi. And now there's something that came out about the misleading ads. And to save my voice, I'm going to have it read to you.
Misleading Ads KFF
Just came out.
analyzed 650,000 airings of Medicare ads that appeared on air between October 1st and December 7th, 2022. While the ads promoted all types of Medicare plans, including Part D prescription drug plans and Medigap supplemental plans, Medicare Advantage ads dominated with 85% of all airings. More than one quarter, 27%, of the Medicare Advantage ads showed images of government-issued Medicare cards or images that closely resembled the official Medicare card. Most, 83% ads sponsored by brokers or other third parties, pointed people to call a private Medicare hotline rather than the official Medicare line, 800-Medicare. More than 50,000 airings used messaging that warned viewers they might be missing out on benefits, suggesting their current coverage could be incomplete. The vast majority of MA ads, 92%, focused on extra benefits, such as dental, vision, hearing, and prescription drug benefits, which most enrollees can get. However, 67% of third-party or broker ads promoted financial benefits, such as getting a rebate for Part B premiums, known as the Give Back benefit, despite just 17% of plans offering such a rebate. Kaiser's Foundation also conducted focus groups to understand how consumers experience the process of choosing a Medicare coverage. The research found that many Medicare beneficiaries were unclear on their Medicare coverage options and the trade-offs between them. Focus group participants noted feeling overrun with often misleading ads. Despite, or perhaps because of, the abundance of messages, participants reported feeling confused or unclear about the options. At a September briefing on KFF's findings, Lindsay Copeland, Director of Federal Policy at the Medicare Rights Center, a national nonprofit organization, said that her organization often receives calls about misleading Medicare marketing. Copeland said that consumers often report feeling unsure who to trust. They may feel pressure to take action based on TV ads or direct mail, even if they are happy with their current coverage. Some report being confused about who is sending them official-looking mail and questioning if offers seem too good to be true are legitimate. According to Copeland, 20% of calls to the Medicare Rights Center's helpline about misleading marketing are from people who were enrolled in a plan without their knowledge or consent. Callers report thinking they were talking with Medicare or believing they were providing information to a broker but not consenting to switch plans. They may only realize what has happened weeks later when paperwork arrives, by which time they have little or no recourse. Other callers say they switched willingly but learned their decision was based on inaccurate or incomplete information and that they failed to understand what they might be giving up. New CMS rules may be shifting the nature of Medicare advertising. Advertisers can no longer use the Medicare logo, name, or the official Medicare card, in a way that could imply that the ads are coming from the official Medicare program. Broker ads will need to specify which plans they are selling, and benefits that aren't available to everyone must be clearly identified as such. We are really trying to rein in misleading marketing practices, Meena Seshemani, MD, PhD, Director of the Center for Medicare, said in an interview. Seshemani said the agency is instituting what she calls common sense rules, and considering the experience of Medicare beneficiaries, who are bombarded by ads and confused about their options, which include Medicare Advantage, Original Medicare, and Medicare prescription drug plans. These are all important pieces of the Medicare program. They are all important options for people to have, she said. But if they are getting confused, and if they're getting misled, then the program's not working for them. In the KFF briefing, CMS Administrator Chiquita Brooks Lejeune said that in response to skyrocketing complaints over the last couple of years, the agency will review all television, radio, and web-based ads in advance to make sure they meet the requirements. These protections that we put forward are really spurred in large part by the feedback that we have gotten through partners and from the people we serve, Lejeune said. What we are focused on is just making sure that people have access to accurate information. According to Seshemani, CMS's objective is similarly focused on consumers' needs.
The misleading ads are still a problem. They really are. They're only focusing on the ancillary benefits, on all the little bitty extras like hearing aid coverage. but they come with hearing, right? And so many times people will literally join a Medicare Advantage plan, not knowing that they're leaving original Medicare for something like hearing aid coverage, or dental is the number one, or something else. Well, here is something that was just posted online this week from an audiologist, that he just wanted seniors to know about Medicare Advantage when it comes to hearing aids. I thought it was pretty interesting, so I'm bringing it to you.
Don't realize is that from a quality of care perspective, if you think that you're going to get excellent quality of care by going with Medicare Advantage provided hearing aids, you are sorely mistaken. Usually it's just a discount plan. And so you're getting hearing aids, but the reimbursement to the providers is so stupid low that they can't justify spending any more than a few minutes with you dispensing you those devices. Otherwise, they lose money, and they don't want to lose money. So what's the option? Get you the heck out of their office as soon as possible.
Yep.
Interesting. So in their own words, I want to share with you this story that just came out. Medicare Advantage denials jump 56%. Now, this is timely information, and the good thing about being able to come live with you and share with you things that are happening right now is these things are really happening in real time. Other agents are getting very, very angry that I'm putting out information as it pertains to Medicare. And since they can't match our now 10 million views on YouTube, and the fact that all of you are sharing our information, which thank you for doing that, by the way, please do share the link for this video on your Facebook feed or LinkedIn so that other people can see really what's going on. They're angry about that. And I could show you some examples, but I won't give them any airplay. But this story, just came out yesterday. Medicare Advantage denials jump 56%. Claim denials are on the rise as hospitals also see diminishing cash reserves, according to a new American Hospital Association report. And I've highlighted this. I'm not going to bore you all day with reading you the whole thing, but if I can make it a little bit bigger. It says, hospitals and health systems have seen a significant spike in claim denials by Medicare Advantage, denying more of their reimbursement. A new analysis, which I could bore you with, but I won't, of data from over 1,300 hospitals. That's a pretty good sample. Performed by Scintillus Performance Solutions and the American Hospital Association, found nearly 56% increase in Medicare Advantage denials from last year until this year. During that period, commercial denials also increased for hospitals nationwide. Those denials, though, rose by 20%. As a percentage of net patient service revenue, Medicare Advantage and commercial denials for the median hospital grew by approximately 63%. The reductions in denial-related revenue come at a time of weakening cash reserves for the hospitals. Health systems had a median of 124 days cash on hand as of June 2023, according to the report, meaning median days on cash on hand was down 28% since last year. That's pretty scary. Diminishing cash reserves mean these critical healthcare organizations are less equipped to navigate sudden market shifts and disruptions, which is especially concerning more than 3 years after the onset of a once-in-a-generation pandemic. Cash reserves mean hospitals and health systems also impact the hospital's ability to respond to sudden emergencies like natural disasters, mass casualty events, and even another pandemic. Payers may be denying claims. This is the interesting part here. Payers may be denying more claims from hospitals and health systems as their organizations face greater congressional scrutiny and lawsuits over claims management practices. Maybe the ones like I've been talking about on this channel, in fact, such as using artificial intelligence to deny claims. Critics have alleged that these algorithms deny claims en masse without proper medical review, the report stated. And let me show you this one. Well, no, I'll just go back. Pretty interesting. 56% claim denials are up. Ooh, here it is. Marketing limits could shake up the Medicare Advantage market. Uh-oh. What does that mean? Modern Healthcare just came out with this morning, and it says, stricter rules governing Medicare Advantage marketing may offer smaller health insurance companies an opportunity to snatch market share from the dominant players such as Humana and United Healthcare. Large health insurance companies have enjoyed generous and creative the agents have enjoyed them. Large health insurance companies have employed generous and creative broker and agent compensation strategies to gain and hold members. That means they're paying the agents more under the table. Some smaller rivals that may lack the resources to match that approach believe limits the CMS, that Center for Medicare and Medicaid Services, wants to establish on those practices could benefit them. And I said that when I showed you the testimony from the lady from the small health plan. And I said, she has a bone in this race, a dog in this race. Yeah, she has a dog in this race because she can't afford to pay out those under the table bonuses. CMS issued a proposed rule this month, which we covered in depth, that would establish a hard cap, which is supposed to be there already, on how much Medicare Advantage insurers can pay brokers and independent agents who sell policies to beneficiaries. The agency touted the draft regulation as a way to promote competition and ensure marketers advise beneficiaries to choose the best policies for their needs rather than the plan that pays brokers and agents the most. Agents would never fall for that, would they? Would they tune their recommendation based on how much money they've gotten, the financial incentive? No. We've got a financial arms race going on in the markets where the smaller nonprofit plans are under a lot of pressure to compete with those kinds of dollars, because if you don't, you may not get mentioned by a broker as they're helping seniors enroll. And that's who said it, Ms. Connolly. Small insurers face steep obstacles in the heavily concentrated Medicare Advantage market. Yes, they do. United Healthcare and Humana offer big bonuses to national marketers, which is why they continue to grow faster than the industry average. Now, this is Modern Healthcare's report. This is not Chris Westphal saying this. I mean, I'm reading it, but said a researcher at investment bank TD Cowen, quote, the plans are paying billions of dollars to brokers and field marketing organizations for administrative costs, marketing costs, and these other things, Taylor said. It's completely unregulated. Right now it is. Surely some of that is going to the pockets of the brokers, which circumvents the whole point of having regulated commissions. It is. Here we've never taken marketing money, and we never will. Never had to. The proposed rule could have negative effects on Medicare beneficiaries. Oh, here come the apologists. The proposed rule to crack down on agents getting paid under the table could have negative effects on Medicare beneficiaries, said Ronell Nolan, President and Chief Operating Officer at the Trade Association Health Agents for America. Really, Ronald? He says health insurance companies would likely ramp up advertising, hire more internal marketers, and contract with fewer independent brokers and agents, she said. That could lead to higher premiums. Really? If you're saving billions of dollars from paying it into the agents' pockets, that could lead to higher premiums? I don't follow the logic there. There's absolutely a trickle-down effect. Oh, trickle-down. That's a great political term that really seems to work. And Security Health Plan, the small plan where the lady brought it up in Congress, said the proposed rule is a welcome first step to enhancing competition, but may not go far enough. CMS already limited how much carriers can pay individual brokers and agents before proposing this new policy, but some insurers sidestep the maximum by categorizing payments to salespeople as administrative or marketing expenses, enlisting sales representatives to perform health risk assessments. Or I talked about that before. You should see the video I did about Medicare Advantage asking you to do an exam, a physical exam. Now they're just doing a health questionnaire over the phone so they can get paid more money. Or contracting with middlemen that pass bonuses on to brokers and agents on their behalf. Yes, they do. It's a real thing. And you didn't have agents telling you about this. And I'm telling you, my agent friends are super, super mad. And now they're taken to this platform and saying things like, we take the money and it's going to hurt us and our agency because we have a cost per acquisition problem. See, it costs us to acquire a client when we have to run ads. That's called doing business. We don't run ads here. What you're watching right now, and I know certain people call on the phone and they say, I saw your television ad. These are not ads, folks. This is just free information. I've always believed that if I can educate people for free, then one day they might reciprocate and do business with us if they find what we have to say to be interesting, compelling, and find me to be an honest person, which I is. This is another thing that came out in the news. This is about Cigna's being sued for the algorithm. And I want to read you this little part of this. If I can make it easier to see. The PDX algorithm was designed for Cigna by Dr. Alan Mooney, a former pediatrician who also worked as an executive at Blackstone, a private equity firm, where he was in charge of reducing cost. Now we're talking, if you didn't see that transition, we're talking about Medicare Advantage companies and how they are routinely using these algorithms, otherwise known as artificial intelligence, to deny claims. They used to have the denial department in there where people just say you're denied. Now they're having a computer just do these denials. And that's the subject of this new big lawsuit, which may become a class action. He came up with the idea to cut the cost of the traditional system under which each claim is reviewed manually by a nurse and then by a medical director. Instead, they match each claim with a set of required conditions. All claims that failed to meet any of the conditions were then rejected by medical directors who were not required to review the files. If you want to see this study and the others, they are in the description of this video. Tracked down by reporters at ProPublica and the Capital Group, Mooney confirmed that PDX was designed to circumvent review by medical doctors. They admitted this. Quote, the PDX stuff is not reviewed by a doc or a nurse or anything like that. It has undoubtedly saved billions of dollars of things that should have been paid just to the people on Medicare Advantage if they needed something. That's what it's about. You don't find this on Medicare Supplement. There's no algorithm. There's no claim denial department. There's not even a medical director in a Medicare Supplement outfit because they don't deny claims. They pay when Medicare pays. It's automatic like that. It goes on. One of the individuals who appeared to have approved denials in bulk was Dr. Cheryl Dopke, who signed off on 60,000 claims in a single month. 60,000 claims in a single month. According to internal Cigna records reviewed by ProPublica, the reporters calculated that Cigna staff spent an average of 1.2 seconds on the 300,000 claims rejected during that period. They spent 1.2 seconds on each one of you. I'm sure what could go wrong? Cigna says that the ProPublica's reporting is filled with factual errors and that the PDXDX algorithm has helped customers. Savings achieved through this claims review process benefit our clients and our customers, not Cigna's bottom line. And there is no incentive for our medical directors to deny claims, a company press release said. What about this story? This was 2 days ago. Is your health insurer using AI to deny you services? A lawsuit says errors harmed elders. The legal action comes, this is the new lawsuit, comes after medical advocates began raising concerns about the routine use of AI technology to deny or reduce care for older adults on private Medicare plans. Oh, you can say it. It's called Medicare Advantage plans. This is unique to Medicare Advantage plans. In 2022, just 1 year ago, as I'm making this for you now, the Center for Medicare Advocacy, which is another group of two, the Medicare Rights Center is an awesome organization. I'll talk about them in just a minute. In 2022, the Center for Medicare Advocacy examined multiple insurers' use of artificial intelligence programs in rehabilitation and home health settings. The advocacy group's report concluded that, what did it conclude? AI programs often made coverage decisions that were more restrictive than what Medicare would have allowed, and the decisions lacked the level of nuance necessary to evaluate the unique circumstances of each case. Last week, I went over case by case by case by case in the Office of Inspector General's report, where they gave many examples of this very thing. Medicare would have paid it. Medicare Advantage plan denied it. Quote, we saw more care that would have been covered under traditional Medicare denied outright or prematurely terminated, said David Lipschitz. We've heard of him before, Associate Director and Senior Policy Attorney for the Center for Medicare Advocacy. He said some older adults who appeal rejections might win a reprieve, only to be shut down again. He cited the example of a Connecticut woman who sought a 3-month stay at a rehab center as she recuperated from a hip replacement surgery. She filed and won 10 different appeals she had to file after an insurer repeatedly attempted to terminate her coverage and limit her stay. You should really read this report. It's linked in the description below. Over and over and over, it talks about the automated denials on Medicare Advantage and why they're doing that. Profit is the motive. It's in the first summary on page 2. I encourage you to read it. Oh, here's another one. Healthcare Services Corporation is using AI for prior authorization. But this one, it has a twist, and this is a better one. This is better. Watch. It's good news. I bring you today good news, glad tidings of great joy. No, this is good on the artificial intelligence front. Hear me out. Healthcare Services Corporation is expanding a pilot integration. This is a few months back. It was a pilot program of artificial intelligence into its prior authorization process. By the way, prior authorization is a mechanism also exclusive to Medicare Advantage. Prior authorization does not exist in original Medicare, except in the nuance of durable medical equipment because it's so rife with fraud. Going to the doctor, getting your surgery, and getting it booked in the hospital requires no prior authorization on original Medicare with a Medicare supplement. That's the other way you can go that no agent is telling you about. Well, I say no. Only 90% are not telling you. So prior authorization is where they're using artificial intelligence. This company is a parent of Blue Cross and Blue Shield of Illinois, promises will make the approval process for many procedures quicker and easier for providers and patients alike. They're looking for an approval process. HCSC said in a statement this morning that it has been using AI technology for 93% of its more than 18 million members for a limited number of procedure codes. The company, with Blue's plans in Illinois, Montana, New Mexico, Oklahoma, and Texas, is using proprietary AI in a prior authorization tool that, quote, streamlines the submission process and provides auto approvals when critical criteria are met, the statement said. You see the difference? They're looking to approve things. The tool does not deny request. That is the difference. It either approves prior authorization or kicks the request to a human for hands-on review by an HCSC clinician. Good job. During an initial pilot in specialty pharmacy and behavioral health in 2022, they said in the statement that approvals were granted 80% of the time for behavioral health decisions and 66% of the time for specialty pharmacy decisions. It does not automatically deny request. Earlier this year, the use of the tool was now expanded to include inpatient acute care, long-term care, inpatient rehab, skilled nursing care, outpatient, inpatient hospice care, home health, outpatient. So basically, they're using AI for everything in the Medicare Advantage world. I spoke about this briefly. I donated money to this organization, and I think you should too, if you have the resources and if you're taken care of on your own healthcare. And let me tell you why. This organization called the Medicare Rights Center does tremendous work. And I hope to, with their permission, share some clips of things that they've been doing, which are outstanding. It's a nonprofit organization, and they will actually take up your claim if you're being denied care and you don't understand what's going on and you're being denied and you need help, you need to know where to go. They can help you. Now, they can't help everybody in the whole country, but they may be able to help you or someone you know. And I get no less than 100 bad stories a day in the comments on these YouTube videos, and I'm doing my best, falling way behind on going through and sifting them and approving them and then replying. Way behind on that. But this organization right there is one that's doing it right. They're actually helping people. And again, if you have the wherewithal, you could help somebody that's on potentially a Medicare Advantage plan get the help that they need to get the care that they were promised. And now that they're stuck, they can't get off of it. They can't get a Medicare supplement later in life, or maybe they just couldn't afford one. And this is what they have, and they can help. Let me tell you what's going on here. This is very interesting. This is also a story from 3 days ago. An ex-IBM sales veteran sues for access to health benefits. Now, what's the problem here? What's the crux of the matter? The crux of the matter is they want to take him off of his Medicare supplement plan and put him on a Medicare Advantage plan. And if he doesn't go, they're going to take away up to $40,000 that they'd promised him in his health care reimbursement account. Let's go to the story. A former IBM enterprise salesperson has sued the mainframe titan, claiming its recent healthcare benefits is age discrimination. On Thursday, 𝗪𝗵𝗻𝗄𝗍𝗍, excuse me, I'm butchering that name, who worked for IBM for 42 years, gave him his life before retiring in October 2020. He filed his own lawsuit representing himself. He told the Register that the reason he chose to sue on his own was to correct the wrong. The alleged wrong in this instance is the employee benefits transition that IBM announced last September. The corporation changed their retirement program for retirees that are already retired. That's pretty shady to do that after the fact. They also shifted their medical coverage from Medicare eligible IBM retirees to a new IBM sponsored, there it is, Medicare Advantage program. They want to put you on the Medicare Advantage program as of January of this year. The company that they want to put them with, coincidentally, was just sued for using allegedly faulty AI algorithm that limited post-acute care among elderly Medicare Advantage patients. As the Register previously reported, IBM's health benefits transition angered some retirees because the American giant withheld health reimbursement account money. Another former IBM employee who spoke to the Register about the transition, asked not to be identified, certainly, likened the situation to a heist. He says he stands to lose his $46,000 HRA balance if he fails to sign up for one of the new Medicare Advantage plans. The problem with doing so, he said, is he would have to give up his what? His Medicare Supplement Plan G. Why would he want a Medicare supplement? Where you can go to any doctor in any hospital in the country that accepts original Medicare and not have to get a referral, not have to get prior authorization, not have to get permission, not have to go through some network. That's why he likes it, and they're making him give it up. He said that he would have to give up his Medicare supplement, which covers costs not covered by Medicare coverage. And as a cancer survivor, he knows. He's been advised to keep his Plan G by Medicare advisors and doctors. Will say it ain't so. The concern is that IBM's new health plans may not adequately cover costs and may change in the future. That's what Medicare Advantage plans do. They change every single year. He claims that the Mayo Clinic won't even schedule an appointment with Advantage enrollees. I covered that last year. It's true. They sent out the letter saying if you got an Advantage plan, it ain't happening. Now, if you have an Advantage plan with an out-of-network benefit, it may happen. Throw that in there. Caveat. While the Moffitt Cancer Center is out of network for the Advantage plans. And now IBM comes along and says, okay, here's just those two plans, and these are the only two that you can pick from. It does have some impact on current employees, but it has a devastating impact on retirees over the age of 60. As things stand, IBM's former employees don't trust the company's Advantage plans or the company itself. Quote, they want nothing to do with these plans, said Bergeron. There's too much negative press on Medicare Advantage plans. They don't trust IBM either. In April of 2022, a report from the Inspector General's office, wonder where we heard about that, found that private Medicare Advantage programs deny 13% of service authorization requests that would have been granted under traditional government-run Medicare. Quote, I was talking to a retiree the other night who has a very serious lymphatic vein disease, Bergeron added, and he's dreadfully worried that a Medicare Advantage plan is going to give him a lot of grief and it's going to be a difficult thing. When New York City tried to change, did you remember that when I covered that at the beginning and all the updates and when they won? When New York City tried to change retired municipal workers' traditional Medicare to a privatized Medicare Advantage program, the situation ended in court and the workers prevailed. The IBM retirees organizing against the transition are currently exploring their legal options. Just by way of an update, This is Marianne, and she's with the New York City Retiree, the Public Service Retirees. And again, I donated money to them because they're fighting the good fight to keep their people on original Medicare and not go the route that the city tried to do, which is just to save money on the backs of their retirees and not keep their promises. So far, they've won. They're currently facing, right now, as I'm making this, 3 different appeals in 3 different courts to try to keep that win in the books. If you'd like to help them with just $1 to help their legal fees right now, because they're mounting, nycretirees.org. It is a great organization doing great things for people who were there during 9/11 and after. These are firefighters, EMS people, the best of the best. This is picked up in another article that is very relevant to this. And let me tell you this story right here. 𝗏𝗏𝗃𝗏, probably butchered that too, president of the National Retiree Legislative Network, told the Register that his organization has been involved in a similar health benefits transition with the Tennessee Valley Authority. Lots of you have been commenting about this. 𝗏𝗏𝗃𝗏 said Medicare and Medicare Advantage plans typically only pay a portion of healthcare costs, about 80%. As a result, many people have private supplemental policies like Medigap, otherwise known as Medicare Supplement, employer-sponsored retiree plans, or Medicaid to make up this difference. But with Medicare Advantage, once you're in a Medicare Advantage plan for more than 12 months, you cannot then buy a Medigap plan unless you meet insurance requirements. That's underwriting. Is underwriting a real hard thing to do? No, it's not. How will you know if you could get qualified through underwriting? How do you know if you could go from a Medicare Advantage plan to a Medicare supplement through underwriting? Oh, there's the website for it right there. SeniorSavingsNetwork.org/underwritten explains to you the process, and we can help you with that process. We can help you until December 7th. Then we can help you from January until March 31st. If we can't get to you by December 7th, which is going to happen in thousands of cases, we're still picking that up again, and we can help January 1st through March 31st if you want to see if you want to go to another Medicare supplement or get one for the first time later in life. Oh, and let me tell you about a little caveat here. The other night, I was answering a question. It was late. Someone asked me about trial right. Trial right is what he's describing right here. Once you're in a Medicare Advantage plan for more than 12 months, you cannot then buy a Medigap plan unless you go through underwriting. So trial right, I have really bad news for you in this context, and let me put it in the proper context. Trial right is a Medicare right, and that says that you can, within the first 12 months of being on a Medicare Advantage plan, if you started it when you started original Medicare. So when your Part A started, at that same day you started a Medicare Advantage plan, now you're in your trial period. And you've got 12 months on your Medicare Advantage plan to see if it's a good fit for you. If it's not a good fit for you, you can go and do an open enrollment do-over, get any Medicare supplement plan you want, get a Part D plan. You're good to go. You're trucking. The second part of trial right, the second other option is the GI version of trial right, which is if you gave up your Medicare supplement, you got on a Medicare Advantage plan for the first time ever in your life, and you gave up your supplement to do so, you can go back to your supplement if it's still available within a year. If it's not available, they have to sell you a guarantee issue version of a Medicare supplement, which basically means you have to get Plan G. You can't get Plan N. In the first example, when you're brand new to Medicare, you can get any plan letter. That's your open enrollment do-over. In the second example, you left the supplement for an Advantage plan. You have 12 months to go get your supplement back. That's not going to happen. Or get a guarantee issue one. Here's the rub, and this comes from experience. Years of experience with thousands of clients on both Advantage and supplements. We write both because we listen to people and we put them on the plan that's most appropriate for them after listening. I'm not all Medicare supplement. A lot of people can't afford them. For those that can't, we do the best job we can to put them on an Advantage plan that we feel will be the best suited for them. Here's the problem. If you're in this situation, for example, IBM, City of New York, Tennessee Valley Authority, and you're on a retiree-sponsored Medicare Advantage plan, and you left original Medicare for it, there is no trial right. Trial right, as it's codified in USC 18, whatever it is in the code, and I can find it for you, specifically talks about Medicare Advantage that's fully regulated by CMS. That means it's got a plan number. You can buy it from Medicare.gov. You could buy it from my website, for example, on MedicareAdvantageNearMe.com. That commercial, open to the public type Medicare Advantage plan does have trial right. These plans, through a retiree-sponsored program through an employer, does not enjoy trial right. You need to know that. Other people won't tell you that, and you can't find that in the Medicare and You guidebook. You have to experience that yourself when you're fighting for your clients, and then you learn that the supplement companies know the law when they don't have to take somebody by guarantee issue. And by golly, if they don't have to take them by guarantee issue, they're not going to take them. And they found this in the law, that if it's a retiree Medicare Advantage plan that these people are being shoved into, it does not give you trial right, folks. So I have to break it to Mr. Burt here, Bill Caterite. That's not accurate. Somebody please send him this video. It is in the law that if a retiree Medicare Advantage plan is one that you're going to, you don't have 12 months like you would if you're getting on a regular Medicare Advantage plan. And sometimes, throw this out there, if you're being forced to either take a retiree Medicare Advantage plan or one that's available to the public, sometimes it might behoove you to take the one that's available to the public, not the least of which for the fact that you have trial right if you take the commercially available one. Woo! Cartwright argues that this state of affairs is being allowed to happen by Congress to avoid tough decisions about how to deal with the spiraling healthcare costs. And business accounts departments like it because there's profit to be made in the Advantage plans. What Congress was trying to do is privatize Medicare. And the way they do that is to subsidize the insurance companies to put them in market advantage, thus cannibalizing their own plan, Medicare, he opined. And now Medicare Advantage plans have a 54% market share, and their incurred cost per enrollee is 9% higher than the old fee-for-service cost. So what Congress is doing is avoiding having to talk about taxes because it affects electability. Got another one for you. But before we get there, please do me a favor and like this video. Please like the video and subscribe to the channel if you're not subscribed yet. How are you going to get Medicare updates if you're not subscribed to the channel? If you don't know how to subscribe, it's a button that should be on this page that says subscribe. If you don't see said button because this is embedded in somebody else's article or on a website, then there's no button. Go to the website that you see here, and it's seniorsavings.org/YouTube. It'll take you right to the subscription. Pretty easy, huh? Thanks for subscribing, and please share this information with somebody that can help, somebody that's on Medicare. 2 ways to go on Medicare, and this is what agents won't tell you. You can either go original Medicare, and that's what you paid into your whole entire life, and you should have the right to have original Medicare. Original Medicare has 2 parts. Part A is the inpatient side, and Part B is the outpatient side. It's the outpatient side that we're concerned with primarily. Although if you do to get a Medicare supplement plan, it also pays that $1,637.33, was it for next year? Cost just to walk into the hospital when you're admitted, it pays that too. So if you go in the hospital on a Medicare supplement plan G, plan N, not going to cost you anything. And that's any hospital in America, unless it's owned by a Medicare Advantage company. And then the Part B, where on original Medicare, you have to pay 20% of all the cost on Part B after a deductible. Then you have to pay an unlimited 20% of the cost. And what a lot of people do is they get a Medicare supplement plan. I've been helping people with those since 1994. Holy cow, that's a long time. Then they can pick up a Part D drug plan using a website like ours at startpartd.com. Startpartd.com until December 7th is the deadline to get a drug plan or to change one. But what most agents are only telling you about is this route right here, telling you about things like dental, vision, YMCA, all those amazing things. They're found in Medicare Advantage. What they fail to tell you about is the major medical stuff, the restrictions, the denied care, the artificial intelligence that's automatically denying care, the restrictions on the network that can change at any time, the restrictions on the formulary that the commissioner in Mississippi just talked about. And I've talked about that before, where you'll get on a plan and then all of a sudden they just change the formulary on you in February. How can they do that? They can. Medicare Advantage is a very windy and twisty road that is not ever the same because it does change every year. But this is the concern. I'm going to play this little clip. This is the concern that I have and the state departments of insurance have also about being lured in from the extra benefits.
Trying to enroll in Medicare coverage for the first time, they meet with a broker or see an advertisement about Medicare Advantage plans offering $0 premiums and boundless supplemental benefits. Sounds good, sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. We, on all of our public presentations and our counseling, we beg the consumers, do not choose your health, your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, maybe no copay for generic medication. But we really want them to look at things like, what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out-of-pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits, specifically cash allowances, debit cards, money to go into the local drugstore and purchase items that aren't covered. And we have counseled numerous individuals, especially over the past open enrollment year. They were very upset with us because we could not use Medicare's Plan Finder tool to order the plans in order of the highest debit card to the lowest. And when we try to circle back to things like their specific providers, mental health needs, and other critically needed services, they really want to focus on those added benefits. And that has been a challenge for us due to the advertisements.
So is there, and I understand the federal government's recent steps to curb deceptive marketing, help seniors sign up for Medicare coverage. Is that helping? Can you see some of that?
We are cautiously optimistic. We'll know more as plans go into effect in 2024. Personally, I've seen a bit of a difference in the commercials that are aired on television and the online ads, but there's still, and I get it, consumers with limited incomes, limited resources, to have those added dollars each month for groceries or utilities is a need. But if we can focus on the critical need, which is their health care and their medical needs, it could hopefully redivert them into plans that are best suited.
Imagine giving up your health care because a plan says you can have the YMCA.
Medicare Advantage so I could have silver sneakers and be able to exercise at my Y. But now I'm having a bad back problem. I've not had surgeries or anything like that. I need to go back to Medicare, but can I go back? What will happen? So please, please, please help me. Thank you.
Getting over 500 calls a day right now, calls just like that. And the stories will absolutely break your heart. And for my agent friends who are getting the subsidy, the marketing money from the Advantage plans and all the rest, and that's all you're going with because it pays you more or because you don't know any better, I feel for you. You need more of an education. You're in the wrong outfit. You've been misled, and you've been led down a path that's really hurting people because you're not showing both sides of the coin. And I know you're sitting back and you're taking pot shots and you're commenting all kind of vile and disgusting things in my YouTube channel because you just don't know better. So bless your heart, but you really should do more education. And I guarantee you, you're going to get an education. You're going to get an earful from all your people when they come back to you. And you're not going to have a story as to why you put them on that plan. If you knew the knowledge of good and evil, you knew what you were putting them into, and you did not warn them. Have we written Medicare Advantage plans this year? We've already written 536 as of today during this annual election period. Yeah, we're writing the heck out of Medicare Advantage plans when it's appropriate, when it's the best thing for somebody. That's when we're writing a Medicare Advantage plan. But I guarantee you one thing, our clients' eyes are wide open. They know that they will have to appeal when they need something expensive done. They know that there are organizations like the Medicare Rights Center who can help with that process. And they know that we're going to stand behind them as best we can. It's them and us against a big insurance company. We are fully prepared. And so is our client when they get on a Medicare Advantage plan. I fully recognize, having dealt with tens of thousands of seniors in my short career since 1994, I know that most seniors out there just don't know what to do, and they really just don't know who to trust. And I've made it my mission to try to become the person that they can turn to for real, honest answers. And I think that's why we have 10 million views on this channel. I think that's why people are sharing it. I think that's why the source of a majority of the views that are coming is because people are sharing the information. So thank you for sharing it. And I'll continue to tell the truth, and you can't stop me. And I'll continue to bring all the stuff that I just brought you was within the last 3 days, except for one article was talking about the Blue Cross thing that happened in July. But all these other things are happening in real time. And there's nobody on the stage right now in the public sector that's putting out the information about what's happening, the good, the bad, and the ugly. Today, I brought you good about Medicare Advantage. Love what the Highmark organization's doing. They're trying to streamline prior authorizations because the backlog of prior authorization is in itself a nightmare. So if you have to have prior authorization in your Medicare Advantage plan, and I know that they do, then at least try to streamline it and get those things approved. That's what they're doing. That should be a precedent that everybody else should be following. I need to go over these dates with you. If you're in this time of the year when you're watching this, from October 15th through December 7th, that's when you can get on a Medicare Advantage plan. Or if you're brand new to Medicare, or you're leaving an employer plan, or you're leaving an individual plan, those are special election periods, a life-changing event. But for everybody else, you can get on an Advantage plan. And let me throw this out there to you and acknowledge this because I know it exists. If you've been a client of mine for 10, 12, 15 years, you've been on a Medicare supplement, and we try to shop those for you when you get a rate increase, and something catastrophic has happened in your health, and you are now chronically fighting something. I do see your comments. I do see the calls. I see the transcripts of the voicemails as they come in here, every one of them. And I know that you've had some kind of a condition where you can no longer play that game of musical chairs and get on the next best rate for Medicare supplement. That's what we do for our clients. And if that happened to you, if they pulled your chair out and you can no longer change Medicare supplement companies, this may be the time. This may be the year that you have to get on a Medicare Advantage plan because you simply can't pay the cost of it. Who would you rather have? An agent that only knows Medicare Advantage and doesn't even have the length in the game to know how to fight the system and advocate for you? Or would you like to have somebody that has a balanced view, knows the good, the bad, the ugly, and wants to be on your side? So if you're going to get on a Medicare Advantage plan, let us help you with that. You can either do it yourself. You can look right on my website. It's approved by CMS. Who is CMS? Center for Medicare and Medicaid Services has approved our website. You can go right there. Let me put it on the screen. And you can sign up for a Medicare Advantage plan by putting in your doctors, putting in your drugs, seeing what the network is, and seeing what the benefits are, and you can sign up for them. We don't have all the plans in the whole country. We don't, because we purposely don't contract with every single thing that's out there. So if you want to see the companies that we're with, you can go to my website and you can see that. If on my website you choose, I need somebody's help, we can only help people to get onto a Medicare Advantage plan, unless you're in a special situation, losing coverage somewhere, until December 7th of every year. Now, once you're on a Medicare Advantage plan, there's a different time frame of the year just for your education. January 1 through March 31, you can change your Medicare Advantage plan. Let's say you didn't pay attention when you got your annual notice of change. You didn't go to my website, seniorsavings.network.org, and see the updates for the new year. And so you just rolled into a new plan that looks nothing like the plan that you enjoyed the last year. Networks are different, copays are different, formulary is different. A whole bunch of things may have changed on you if you didn't pay attention. You can change your Medicare supplement during the first quarter of each year. You could also drop your Medicare Advantage plan. Did I say supplement? You can change your Medicare Advantage plan during the first quarter of the year. You can change your supplement all year long. So if you want to change your Medicare Advantage plan and we can't help you, or you want to drop one and you need to go through underwriting and we haven't gotten to you yet, you've got the other time frame from January 1 to March 31 where you can accomplish the same thing. You can either change Advantage plans or drop Advantage plans, but you can't go get one for the first time after December 7th. Just want to make sure that's clear. If you have other questions and you don't know where to go, please start at our website, any of the websites that I've listed here. Oh, you've got to see some of these. They're really cool. These are comments from folks. I never get an advantage plan. My sister, and these are just some of the stories. I'm telling you, there are hundreds of stories every day. And this one was at 3 o'clock this morning. I think it was. I pulled this one out. Never get an advantage plan. My sister had no help, has had no help. It is so sad and criminal the way she has had no help. She gets her hometown doctor to make her appointments to specialists, but they won't take her because she's on an advantage plan. So she's suffering. Please beware. You have to know that if the plan that you choose has a network, you have to be very careful and make sure that you're playing by the rules of the plan. You have to stay in their network. If you have a PPO plan, yes, you can go out of the network, but the big benefit, the big words of saying that you can go out of the network is kind of broken up by the small print that says, if the doctor accepts you and your costs are going to be super high and your max out of pocket is going to be even higher. But I do prefer a PPO over an HMO because you do have an out of network option. Noelle was telling me today, she was looking at a plan, but the out of network cost was 40% of the bill. Yes, there's an out of network provision, but you better look carefully and see what that actually is. The person didn't know, the other agent hadn't told him, just said, yes, you can go out of network. There's more to it than that. Education is the key. This one said, after a hospital stay, it cost my father-in-law over $30,000 for a stay in rehab. Rehab, rehabilitative center or skilled nursing, is the biggest downfall of Medicare Advantage. And you have to know this going in. From the congressional testimony with the lady from Wisconsin, the attorney that helps people fight these appeals, this is routine. It's an automatic decline. While at the rehab, he ended up broke a hip. Both the Blue Cross and Medicare Advantage denied his stay. He ended up passing away after the entire facility got COVID. Gosh, that's horrible. So she paid almost $15,000 a month for them to kill him. This is just somebody's story. This is not just lip service. These people are incredible. Oh, this is a testimonial. With myself, they got me off an Advantage plan, an unbelievably major misnomer, and onto a supplement where I should have been to begin with. I bought into that dog and pony show 3 years ago and have regretted it ever since. Just keep at it. It can be done. Thank you very much, Christopher. It is very stressful to decide every enrollment period. My agent never offers supplements. And just so you know, I want you to understand the difference. If you're in a Medicare supplement plan, it does not change. It cannot change. Your benefits under a Plan G that you bought ages ago and the Plan G you can buy now are the same. Your Plan N, since its inception to now, is the same. It will not change. There's no network to worry about, to look at. So my clients that are on a Medicare supplement plan don't have to do anything this time of year. We send out an email, we put out the videos and everything saying, please don't do your Medicare supplement shopping and changing during AEP. That's this period of time. Why? Because we have thousands of people that are on Medicare Advantage that want to either change it or drop it or get one for the first time. And they have the hard and fast December 7 deadline. So if you have a Medicare supplement, you don't have to worry about it during this period of time. And that's where this stress comes in. Stressful to decide every enrollment period. I know that's a Medicare Advantage phenomenon. When I was admitted to the hospital due to a sudden, oh, you can't read that one. That's too small. Get out of the way. When I was admitted to the hospital due to a sudden attack of microscopic colitis, that's not good, and spent 5 days because my kidneys had failed due to dehydration when I was ready to go home. My Advantage plan, Blue Cross Blue Shield Medicare Advantage, refused to pay the $37,000 bill. The hospital had to change the coding to an outpatient charge because some algorithm said I was not sick enough to have been admitted. Oh, I should have blocked that out. We are now back on real Medicare with a Medigap policy. The main reason I went with an Advantage plan was for the dental vision coverage. Why doesn't Medicare cover dental and vision? It was never intended to. Medicare was never intended to cover all the costs. And that's why original Medicare covers 80% of the costs on the outpatient side. Dental and vision was not planned to be a part of original Medicare. We have a website where we have dental and vision and hearing plans available. It's called AmericanDentalCoverage.com. You can start the conversation there about plans that are available. And these are real dental plans. Like you can go anywhere, or you could use a network if you want to for better discounts. Covers vision, covers hearing aids. Like you can go anywhere for the hearing aids. That's a pretty significant thing. The ones that are on Medicare Advantage for just all the bells and whistles are not enough to entice a person, if they know the difference, to give up their major medical part to go on it. And like you just said,
is that from a quality of care perspective, if you think that you're going to get excellent quality of care by going with Medicare Advantage provided hearing aids, you are sorely mistaken. Usually it's just a discount plan. And so you're getting hearing aids, but the reimbursement to the providers is so stupid low that they can't justify.
Finally, although so much more needs to be done over the scams these companies are doing to our elderly, I stand with you, Mr. Westphal. You'd be hilariously, I should really show some of the voicemails where people call me every name under the book, like Westfield, Westphalia, everything else. But it's actually Westfall, like you go west and then you fall down. Anyway, I stand with you, Mr. Westphal. Your team has helped with several important issues just in the last few weeks. Keep up your hard work because it is appreciated. God bless you and yours. Thank you very much, Susie. Appreciate that. I think this is my last one I'll share. I want to thank you for posting this video. I made my friend who was already signed up for an Advantage plan, but still had 8 weeks before the deadline after listening to this with her on the phone in another state. That's creative. That's very cool. Thank you for sharing it. She changed her plan to a supplement G with a $6 a year Part D. Yep. That's the 50-cent plan. We talked about that. If you're wondering, is that plan real? Yes, I got it covered on my channel. Look at it in the videos. You should see them. She's alone in a state that's far from her nephew, and that's her only family. She's like me and have no one to depend on if we had any medical issues that needed help. That is rough. Thank you for all your hard work and long hours trying to educate and keep people informed. God bless you. One more. I'm passionate about this topic, and you do a really good job of explaining and showing us what's going on. I worked for the disadvantaged plans for 30 years as a provider relations rep and contracting the doctors. The PCPs drive the care for the patients. That's the primary care physician drives the care for the patient. That's because they get capitated rate, and they are the ones that have to decide if they're going to give you a referral to a specialist in the typical HMO model she's talking about. And they pay them for managing the care in a cost-effective manner, i.e. denying care using the less expensive specialist, etc. I will be turning 65 this February and will not be giving up my Medicare to any of the Medicare HMOs, PPOs. That's awesome. And it pays to be informed. And I want to protect anybody I can get a hold of to just have the information, the right information. You don't have to use our service, but please, you'll know them by their fruit. If you go to an agent and you're new to Medicare, several things to look for there. And I've got a video too on how to pick a good agent, but let me just tell you the basic criteria. If they explain away your option for a Medicare supplement by saying, oh, seniors can't afford those rates go up all the time, you still have to go get a drug plan, and they don't cover dental and vision and hearing. So why would you want to pay all this money? I've covered just a few of the reasons why you need to consider at least a Medicare supplement, because you have one chance to get a Medicare supplement when you're new to Medicare without underwriting, unless you live in the state of New York, Connecticut, Massachusetts. For the vast majority of the country, you've got one chance to get this right. After that, though, you're going to need an expert in Medicare supplement underwriting if you want to see if you can get approved for one. But the best time to get one, or at least know your options, and that's all I'm saying. The fruit of an agent who is a Fruit Loop and doesn't give you both sides, or just talks down about Medicare supplement because they don't sell them. Saw one of the agents that's in a group on Facebook at 3 o'clock this morning, scrolling through, does not sell Medicare supplement and listed all those reasons that I just mentioned. They cost a lot of money. Seniors can't afford them. The rates go up. It doesn't have dental with original Medicare and a supplement. So what are you going to do for dental? You can get a dental policy. if you want one. What do you do for vision coverage? Oh my gosh. Ophthalmology is covered by Medicare, so it's covered by the supplement. Getting your cataracts done, glaucoma, wet macular degeneration, all medical things fully covered by Medicare, and you pick your own specialist to go to. That's the cool part. And then your supplement covers it. I'm trying to give you both sides of the story. That's my goal. That's my mission. And then on the back end, work extra long hours with our team who's working very, very hard right now, trying to help as many people as we can. Please share this information. Don't just enjoy it and consume it and keep your light under the bushel. Just like, I found it. This is good stuff. I'm on the right plan. Please come and be an advocate with me to get the message out. If it's not mine, if it's one of the agents that works with me, or is a fellow friend on YouTube that is giving both sides of the coin, and you like them better because their analysis is much better than mine, please share their information. But we need to get out that there are two different ways to obtain your Medicare to anyone that's making that vital decision at that vital time, or has experienced the negatives of one side or the other. Either you can't afford your supplement because that's the only negative there is there, and they need to shop it for a better rate. You may be on the right plan, but now with the wrong company, and we can help with that. Please, after December 8th, because this time period is only for the Medicare Advantage world. You don't have to worry about it next year if you're on a supplement. I've talked a long time. I've shared with you a lot of news stories going on, and please make sure you're subscribed to keep updated on what's happening in the future. God bless you. Thanks for watching, and we'll see you next time. Bye-bye. Oh, I need to put my end screen thing on there so you can see what to watch next. Like these right here. Thanks for watching, y'all. Appreciate you.